When taking skin fold measurements, all of the measurements should be taken on the right side of the client's body while the client is standing upright. The caliper should be facing up with the numbers facing upward as well and should be placed onto the client's skin 1 centimeter away from the thumb and index finger that is holding the skin fold. The caliper's pinch should be perpendicular to that of the fold and halfway between the crest and the base. The following picture illustrates exactly how the pinch should look like when performing the skin fold measurements. A total of 7 sites should be measured, which include the chest, mid-axillary, subscapular, triceps, suprailiac, abdominal, and thigh. Duplicate measures should be taken at each site. However, one must rotate through all of the sites before retesting the second time. Retesting of the sites should be done if the measurements are not within 1 to 2 millimeters of each other. With the arm held freely at the side, the tricep fold is located on the posterior midline, halfway between the acromion and olecranon processes. The subscapular fold is a diagonal fold and is located 1 to 2 centimeters below the inferior angle of the scapula. The chest or pectoral fold is a diagonal fold and is located 1/2 the distance between the anterior axillary line and the nipple for men, or for women it is 1/3 of the distance between the anterior axillary line and the nipple. The mid-axillary fold is a vertical fold at the level of the xiphoid process of the sternum. For women, you may need to lift up the training bra in order to locate the fold. The abdominal fold is a vertical fold and is located 2 centimeters to the right of the umbilicus, or the belly button. For the suprailiac fold, you may ask the participant to point to their hip. It is in line with the natural angle of the iliac crest, taken in the anterior axillary line, immediately superior to the iliac crest. It is a diagonal fold. The thigh is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease of the hip. After finding the measurements for each site at least twice, one must use the mean of those two measurements and sum all of the sites together. Using the sum of the skin folds, one may use the equation for body density either for male or female respectively. Once body density has been found, one can use the Brosnek or Siri body fat percentage equations to find the total body fat percentage of the client.